Happy morning, everyone. Welcome to Metier YouTube channel. I hope you are all fine and doing well for your exams. We'll start today's important 5 MCQs for the exam of AIIMS and JIPMER. So before starting, we'll start with a small quote. When you want to give up, remember why you started, the purpose of study, why you are preparing. Okay, whenever you are going to thinking about the give up, so always before giving up, think that why you have started, the purpose, why the journey is started, why you started the study journey. Think that, okay, that will boost up you. Clear? Yes, we'll start. First question, typical pain of osteoarthritis is. So we have seen the osteoarthritis question day before yesterday also. So here the question is typical pain. So what kind of pain will be there in the osteoarthritis? First one is aggravated by rest and relieved by use. Aggravated by rest and relieved by rest. Aggravated by use as well as from rest. Aggravated by use and relieved by rest. Tell me what is the answer? The correct answer is option D, aggravated by use and relieved by rest. So this is the main important key feature when you compare the osteoarthritis versus rheumatoid arthritis. In osteoarthritis, the pain will be started after your movements are overuse. That time only the pain will be started, but it will be relieved by rest. Whereas in the rheumatic arthritis, the pain will be there when you take more rest, especially in the morning after your complete bed rest. For example, you're going to sleep today night. Next time the patient is going to wake up, that time the stiffness will be very high and the pain also very high. Okay, that is the key point between the osteoarthritis and the rheumatoid arthritis. புரிஞ்சுங்களா? ஆஸ்டியோஆர்த்ரைட்டிஸ்ல பெயின் வந்து நம்ம மூவ்மெண்ட்ஸ் அதிகமா இருக்கும்போது நம்ம பாடி ஜாயின்ஸை யூஸ் பண்ணும்போது தான் அந்த பெயின் வந்து அதிகமாகும். அதான் ஆஸ்டியோஆர்த்ரைட்டிஸ். அதே ஆஸ்டியோஆர்த்ரைட்டிஸ்ல ரெஸ்ட் எடுத்தீங்கன்னா ரிலீவ் ஆயிடும். ஆனா ருமட்டாய்டு ஆர்த்ரைட்டிஸ்ல ரெஸ்ட் எடுத்தா தான் பெயின் அதிகமாகும். பிகாஸ் ஆஃப் ஸ்டிஃப்னஸ், பாடி ஸ்டிஃப்னஸ் ஆனாதான் பெயின் வந்து அதிகமாகும். இதுதான் மெயின் கீ டிஃபரன்ஸ் பிட்வீன் த osteoarthritis and rheumatoid arthritis. Clear? Yes. So here the answer is option D. Next question. Asthma is basically, the question is asking basically what type of disease is asthma. Option A, an infectious disease, an autoimmune disease, an atrophic disease, a malignant disease. So it looks like a simple question, but it is a little tricky. Think and answer. It's not an infectious disease, right? It is not an autoimmune disease. It is not a malignant disease. It is an atopic disease. What is atopic? Okay, primarily asthma is a allergic reaction. So overreaction of allergic reaction is called asthma, right? So atopy in the sense is a genetic predisposition to develop allergic reaction. That means our body genetic material is already rearranged by birth itself, okay, to overstimulation to the some allergic substance. அதாவது நம்ம பாடி நம்ம பிறக்கும் போதே நம்மளோட ஜீன்ஸ் வந்து பாத்தீங்கன்னா அலர்ஜிக்கு வந்து ஓவர் ஸ்டிமுலேஷன் ஆகி நம்மளுக்கு ஆஸ்துமா வர்றதுக்கான சான்சஸ் இருக்கு. ஸோ அந்த கண்டிஷன்ஸ் நம்ம சொல்றதுதான் அட்டோபிக். ஸோ ஆஸ்துமா இஸ் basically atopic disease. Clear? So what happens in the asthma? And there is our immune system is overreacts to the triggers. It causes inflammation, constriction of the bronchus, okay, that leads to wheezing, coughing, and shortness of the breath. This is a pathophysiology of the asthma. So immune system is overreact to the triggers like allergy, allergen, pollens. Many allergens are there. Okay, that we'll see in the later on our classes. Okay, here answer is an atopic disease. Asthma is an atopic disease. Next, question number 3. A simple instrument to roughly determine lung function is what? So a simple instrument that will roughly determine our lung function is what? The given options are barometer, manometer, peak flow meter, sphygmomanometer? So the answer is peak flow meter. The peak flow meter, simple instrument, is used to measure the lung function. It measures the maximum speed at which a person can forcefully exhale air, known as the peak expiratory flow rate, PEFR. That is why it's called a peak flow meter. Others also will measure the pressure, but not the peak expiratory flow meter. It is directly related to the lungs. I'll show the picture. So this is the peak flow meter. Okay, this is especially used in a child or adult who is having the asthma. Okay, so we'll tell the patient to exhale the air as much as forcefully. Okay, the normal peak flow meter level will be 400 to 700. Okay, 400 to 700 in adult. For children, it is 250 to 500. Okay, 250 to 500 for the children's. Clear? It's a peak flow meter, especially used for the asthma patient to check the peak flow expiratory volume. Okay, peak expiratory flow rate. So this is what it is, barometer. It is helps to measure the options they have given. No, option A. This is a barometer. It is helps to measure the atmospheric pressure. Okay, atmosphere pressure. That is barometer. This is manometer. Okay, the manometer option B they have given. This is manometer. It is helps to measure the pressure in the pipelines, especially in the oxygen pipeline, right? That is manometer. This everyone notes option D. It is sphygmomanometer to measure the blood pressure. Clear? So the simple instrument to roughly determine the lung function is peak flow meter. Next, the following drug cannot cause asthma. So that means one drug is which will not predispose to asthma, but remaining will lead to the asthma. So to answer this question, you should know the actions of the each drug. Then only we can answer the question. So the correct option is atropine. Why? Beta blocker can cause bronchospasm. What is beta blockers? Yes, beta blockers are the antihypertensive drugs as well as it reduces the cardiac overload. Okay, it leads to the bronchospasm. Okay, and it worsens the asthma. Histamine leads to the allergic reactions in the allergic reactions in the bronchioles. It can trigger the allergic reaction. Okay. Next is ibuprofen. Ibuprofen also can induce bronchial constriction in some individuals. Okay. So all these three options can lead to the asthma. Okay. And option D is atropine. You know what is atropine? Atropine is an anticholinergic drug. Okay. That blocks the actions of the acetylcholine so that the smooth muscle constriction will be prevented here. So that is why atropine will not lead to the asthma. Clear? Yes. Next question. Fifth question. In an acute severe attack of asthma, it is important to get a chest X-ray done to rule out what? The scenario is telling the patient is having the asthma. So the physician orders to do the chest X-ray. As a nurse, you know that why the chest X-ray is related to the asthma. Asthma is an allergic reaction. So why the need of the chest X-ray? So that means some disease. So one of these four options, one disease is mimicking like asthma. That means its symptoms are similar to the asthma. ஓகேங்களா, இந்த 4 ஆப்ஷன்ஸ்ல ஒரு டிசீஸ் வந்து ஆஸ்துமா மாதிரியே சிம்டம்ஸ் கொடுக்கும். ஸோ அதை டிஃபரன்ஷியேட் பண்றதுக்கு தான் physician given the order to do the chest X-ray. So which disease will mimic just like an asthma? So the answer is pneumothorax. Clear? So the pneumothorax, it's show the symptoms of just like an asthma. Okay, so that is why we have to differentiate whether it is asthma or pneumothorax. What is pneumothorax? When there is an air leakage in the space between the lungs and the chest wall. Okay, that leads to the lung collapse. So that is why these pneumothorax also symptoms will be same like asthma only. Okay. So both the condition we required a intervention. First, we have to differentiate it. Okay, whether it is asthma or pneumothorax, we'll differentiate. So according to that differentiation, we will give the treatment. Clear? Yes, that is why we are doing the chest X-ray during the asthma attack. Clear? Yes, thank you. I hope the class was helpful. If you like the class, please comment in the comment section how the classes are going. Thank you so much. We'll meet in the next class.